Hi, Malcolm Linsell here. I set up this YouTube channel because I'm a big advocate of the Drainless day procedure Abdominoplasty or DDA. And I thought it might be worthwhile just to take a few minutes to explain why I think this is such a big deal. Now, abdominoplasty procedures have been performed for about 135 years. And when I first started training about 35 years ago, nothing much had changed because I was taught to do wide undermining of the skin. Definitely no liposuction was to be used. Every patient had drains, and the drains would often stay in place for up to 10 days. And all patients would stay in hospital for between 3 and 5 days. Now, I started practice about 32 years ago, and I was aware shortly after that one of my colleagues in Melbourne, Alan Kalis, was actually doing a day procedure, abdominoplasty, and I wasn't quite sure how he could actually do that. And then about 15 years ago, the first drainless abdominoplasty was done. And I wondered if it might be possible to bring the two together, to do a drainless day procedure, abdominoplasty. So about 6 years ago, I learned the technique where I was able to do exactly that. And over the last 6 years, I've done about 200 of these procedures. And I have found they have made a significant difference in 3 areas. The first one is that there is less pain with this procedure. Now that is, I think, due to a number of factors, but the most important ones are that I use a long-acting local anesthetic, which I place in the muscle layer just before the end of the operation. And that gives up to 24 hours of relief from severe pain. It makes a major difference. The second thing is I put in a lot of stitches underneath the skin, bringing 2 raw surfaces together. Now that's important because when you don't have the stitches and you've got 2 raw surfaces together, when a patient moves without the stitches, the raw surfaces rub on each other and that causes pain. But when you've actually stitched the raw surfaces together, when a patient moves, the raw surfaces move together and that is less painful. So that's the first thing. Drainless day procedure is less painful. The second thing I've found is that I have less complications. Less complications such as bleeding, seroma. Seroma is a collection of fluid underneath the skin of the tummy, which is really common in a post-operative abdominoplasty, even with drains. And thirdly, I have less serious complications, be they deep venous thrombosis or DVT and pulmonary embolus or PE, because those are really serious and can potentially kill somebody. So I've had dramatically less complications using a DDA. And the third thing I've found is that there is less downtime for my patients. So because they get to recuperate in their own home rather than in a sterile hospital environment, they tend to do better. And most of my patients are back at work before the 2-week mark. And in fact, if they work from home, they're often working within a few days of the operation. So a DDA really does make a difference with pain relief, less complications, and less downtime. And I've found that over that 6-year period that there are 10 steps to having a successful DDA. And over the next few weeks and months, I plan to share those with you with separate video sessions where I can explain what's required so that you can get the very best result from a drainless day procedure abdominoplasty. Thanks.